Hello, my name is Trevor Mullins. I'm a clinical pharmacist at Mountain Comprehensive Health Corporation. Today I'm going to be talking about our 340B drug pricing program and how it's beneficial to our patients and Mountain Comprehensive Health Corporation.
And I'm Rachel Hamilton. I'm also a clinical pharmacist at Mount Comp, and I'll be talking about the COVID-19 vaccines.
All right, so leading into things, what is the 340B drug pricing program? It is a special program that certain types of covered entities is allowed to take part in to purchase drugs at a much cheaper price. This helps stretch scarce federal resources as far as possible, so it can help Mountain Comp provide more services to more areas and also provide cheaper drugs to our patients. So, what would a patient have to be considered 340B eligible? There's three categories that determines 340B eligibility. One is a Mountain Comp provider. You have to see a Mountain Comp provider to be 340B eligible. Two, you have to be a Mountain Comprehensive Health Corporation patient. So either a new patient or been seen within the last year, and you have to have a documented visit in the chart. And three, it has to be at one of our contract pharmacies that we utilize. Currently, we have just over 30 contract pharmacies. If you have any questions about where these pharmacies are located at, feel free to reach out to myself, Rachel, or any Mountain Comprehensive Health Corporation staff. These are spread out all throughout our clinics in the region, and we're actually working on getting a list ready for the website so it will be easier to access. Patients will know where to go to get these pharmacies. So, what is the 340B drug program? Basically, manufacturers have to be able to provide 340B drug costs to certain covered entities, like ourselves, being a federally qualified health center. In order for those manufacturers to take part in Medicaid, in the Medicaid system, they have to offer a 340B discount. Basically, we have to enroll every year to be qualified for 340B. So this will be at any of our Mountain Comprehensive Health Corporation clinics. But another thing that we have to take into consideration with these 340B price drugs is we can't transfer them out to other health centers or just hand them out to anyone. Like I said before, you have to be a Mountain Comp patient, you have to see a Mountain Comp provider, and it has to be at one of our contract pharmacies. Just a few examples of this. I mean, we can't specifically give out 340B pricing, but you can see upwards of 25 to 50% cost reduction in some medications. And on top of that, we also offer a sliding scale policy at some of our pharmacies. So if you're a patient that is under 200% of the federal poverty level, we can provide medications to you at a discounted price. Depending on what level that you fall in, that may be $5, $10, $15, or $20 copays. If you're above that 200% of federal poverty level, basically you would be responsible for the complete drug cost, and that would still be you would still get 340B pricing for it, but it may not be at those lower costs. So how's it helping MCH these patients? One, it's helping them afford their medications. You're staying more adherent to your medications if you can afford them. And a lot of our Medicare patients, they end up in that donut hole with prices skyrocketing on drugs. They can go from $100, $200 copay to maybe $20 or so. So it's a huge cost savings for our patients, and not only just on the drug cost side of things, it also helps support our health center and offer more services. So typically, us as a health center, if we didn't have the 340B drug program, we might break even on medicine usually, but with the 340B drug program, we're able to have more patient savings and turn those into new offerings like optometry, dental, chronic care services, patient assistance, just you name it. Any type of service, we can utilize 340B funds to help our patients and provide more services in the community. So what are some of the threats that is happening to the 340B drug program right now? 340B is under scrutiny from a lot of drug manufacturers. Some of these manufacturers are actually trying to pull out of the program and not supply drugs to their contract pharmacies. It's a real shame for the patients. I mean, I've had people come in and say that they're not able to get the drugs, and it's really limiting their options on what we can provide for our patients. So, you know, we really need to be better at advocating to keep 340B, to keep our health centers and hospitals in the area afloat and be able to offer these services to our patients. Another way that manufacturers are trying to damage the 340B drug program is they're wanting to try to turn it into a rebate model. So instead of having the upfront cost that the patient's saving, they're wanting to actually trying to come back in on the back end. To me, this is just going to make it a lot messier for our patients and be a lot harder to be able to see who is 340B eligible and who is not. And, you know, it may even cost some people a lot of money as far as drug costs and not even be able to access their meds. So let's see. But if you have any questions about the 340B drug program, feel free to reach out to myself at the Whitesburg Medical Clinic or Rachel Hamilton here. We'd both be happy to help. And if you have any questions about what pharmacies is eligible, we do have specialty pharmacy contracted. We have regular chain retail pharmacies and independent pharmacies. So we have you covered at about anywhere on the spectrum of your needs as far as 340B medications goes. It's something that really helps a lot of our community. I've had people come in tears that being able to afford their medicine now, where they was having to choose between their medicine or a light bill or putting food on the table. Keep in mind, this is not insurance. It's available to every mountain comp patient. You don't have to qualify for it any other way other than just being a patient and seeing a provider here at one of our clinics. But you have to have that healthcare record of it for it to be considered 340B eligible.
Okay. And I'll start talking about the COVID-19 vaccines. So as of right now, there are currently 3 available COVID-19 vaccines. 2 are what's called mRNA vaccines. That's Pfizer and Moderna. And you have the viral vector vaccine, which is the Johnson & Johnson or Janssen vaccine. The Pfizer vaccine has 2 formulations. One is for pediatric patients from ages 5 to 11, and the adult formulation, which is 12 and up. And those are both a 2-dose series, so the patient will receive their first dose, and then 3 weeks later, they will receive their second dose. So for the pediatric patients, ages 5 to 11, it's a 2-dose series, and it is separated. The 2 doses are separated by 3 weeks. There's no booster dose currently recommended for this age range. However, if a patient is moderately or severely immunocompromised, they can receive a 3rd dose, which is administered 28 days after their 2nd dose. For the adult formulation, it is also a 2-dose series, and it's separated out also by 21 days or 3 weeks. Some patients may qualify for an extended dosing interval, but that would be a conversation to have with your healthcare provider if you qualify for that. A booster dose is recommended in patients 12 and up for Pfizer, and that booster dose is administered 5 months after they have received their 2nd dose. And for the Moderna vaccine, it's actually administered 28 days apart from your 1st and 2nd dose. But it also qualifies for a booster dose as well. That's also administered 5 months after a patient has received their 2nd dose. If a patient is moderately or severely immunocompromised in the pediatric range or the adult range, they qualify for a 3rd dose, and that's administered 28 days after they have received a 2nd dose. Then they're eligible for a booster dose, and their time frame for receiving a booster dose is 12 weeks or 3 months after they received their 3rd dose. And then certain age ranges or moderately or severely immunocompromised patients qualify for a second booster now for patients, say 50 and up or certain conditions, and that's to be administered 4 months after their first booster dose. For the Johnson & Johnson vaccine, it is a one-time dose, and you can receive a booster dose if you're not moderately or severely immunocompromised, because that has different recommendations, but you can receive that 8 weeks after you have received your first Johnson & Johnson vaccine. If you are moderately or severely immunocompromised, it's recommended to get a second dose, and that second dose is recommended 28 days or 4 weeks after you received your first dose. And that is recommended to receive an mRNA vaccine, which would be Pfizer or Moderna. And the patient population also qualifies for a booster dose, which is to be administered 2 months or 8 weeks after their third dose. And those patients too qualify for that second booster. The second booster for all patients is only currently recommended for mRNA vaccines, which is the Pfizer or the Moderna, but it's the same amount of time, and that's 4 months after their first booster. Side effects to look for with the vaccines include maybe a little bit of pain or redness, swelling at the injection site. Some patients may experience body aches, fatigue, headache, chills, nausea. That can happen. Some ways to help ease the side effects are there's certain medicines such as Tylenol or ibuprofen that you can buy over the counter that's recommended, but always have that conversation with your healthcare provider on the best medication for you, or if you're able to take that, if that's what they recommend. For pain at the injection site, you can try a clean, cool washcloth, wet it and just apply it to the area. That can help that. With a fever, dress lightly. And then for a fever also, you can drink plenty of fluids. Try to work your arm after you get the vaccine, because that can help ease that soreness that some patients can develop. A few other things are you can receive different vaccines along with the COVID-19 vaccine on the same day. The healthcare provider would just administer it in a different area on the arm from where you got your COVID-19 vaccine. We at Mountain Comp offer all formulations of the COVID-19 vaccines at mostly all of our clinics. Those are available during our normal hours of operations. You can call me or Trevor, any of the clinics, for further questions on that, but you do not need an appointment to come and receive a COVID-19 vaccine. A couple new questions that we've been seeing are the difference in being fully vaccinated and being up to date on your vaccine. So being fully vaccinated is when you have received all of the recommended doses. So for Pfizer and Moderna, it would be the first 2 shots, and for Johnson & Johnson would just be that 1 shot. That is 2 weeks after you've received those doses, or dose for the Johnson & Johnson, and then up to date is after you have received your first booster dose of any of the formulations. If a patient has been recently infected with COVID-19, they can receive a vaccination as soon as they are out of their quarantine or isolation period following those CDC and healthcare guidelines, and after they have fully recovered from the infection. And we would be happy to answer any further questions. Just contact us here at Mountain Comp, and we'd be happy to help you.
Again, my name is Trevor Mullins. I'm a clinical pharmacist at MCHC. And if you have any questions about the 340B drug program or COVID-19 vaccinations, feel free to reach out to myself. I'm located at the Whitesburg Medical Clinic, and you can reach me at extension 2377.
And I'm Rachel Hamilton. I'm also at the Whitesburg Clinic with Mountain Comprehensive Health Corporation, and I can be reached at the same extension also.